Next, I'm going to assess the posterior thorax. So I'm going to ask the patient to sit up straight. I'm going to move behind the patient and place my fingers at the level of the thyroid. The borders should be palpable, but they should be non-tender and there should not be any masses. I'm looking at the skin on the patient's posterior thorax, basically making sure that both sides of the back are symmetrical. I can assess the patient's spine by having the patient stand and bend over at the level of the hip. Standing behind the patient, I can assess the spine for symmetry and looking for any deviation that would be present with scoliosis. I'm looking at both scapula, making sure that they're symmetrical bilaterally. Next, I'm going to auscultate the breath sounds, making sure that they are clear and resonant. So making sure to go over all lung fields from top to bottom. Again, they should be clear and resonant. Next, I'm going to look at the patient's buttocks. This is, especially in the elderly, it's important to make sure that there's no redness around the area if they are restricted to the bed. Last, I'm going to assess the genitalia. When you're assessing the genitalia, you're basically looking for any abnormalities such as redness, discharge. You want to make sure that the skin is intact and that there's no tenderness around the area. For males, you want to look for the presence of any inguinal hernias. Then lastly, assessing the rectum, you're looking to make sure that there's proper closure of the rectum, that there's no redness around the area, the skin should be intact, and then lastly, you want to look for the presence of any hemorrhoids or bleeding. And then in closure, you just want to make sure that you summarize all your findings, making note of any abnormal findings. You want to ask the patient if they have any questions at the end of the assessment, anything that they need to tell you that they might have thought of during the assessment. And then on your way out, you want to make sure to wash your hands, perform hand hygiene, put the room back the way it was before you came in, make sure that you give the patient their call bell, put their bedside table back near them so they can have their personal items in reach. And then provide for privacy by closing the door when you leave.